Hi everyone, this is Nurse Anna from nursestudy.net. Today we have HESI Vocabulary A1 questions. I put together a free NCLEX survival study guide to help you stay organized and confident. Feel free to download it with the link below. And if you want more resources, we have study guides and free nursing audiobooks in our store. You'll find all of those links in the description. Question 1. A patient who is extremely thin due to prolonged illness is described as A. lethargic, B. emaciated, C. febrile, D. labile. Correct answer, B. rationale. Emaciated means severely underweight or extremely thin due to illness or malnutrition. Question 2. The nurse instructs the patient to cease activity if chest pain occurs. What does the word cease mean? A. begin, B. stop, C. reduce, D. avoid. Correct answer, B. rationale. Cease means to stop or bring to an end. Question 3. A patient's pupils dilate in a dark room. What does dilate mean? A. shrink, B. dry, C. expand, D. contract. Correct answer, C. rationale. Dilate means to widen or expand, opposite of constrict. Question 4. The provider noted that the patient was experiencing dyspnea after walking up the stairs. A. difficulty breathing, B. nausea, C. chest tightness only, D. excessive sweating. Correct answer, A. rationale. Dyspnea means difficulty or labored breathing. Question 5. A nurse observes that the IV line is patent. What does patent mean in this context? A. painful, B. blocked, C. open and unobstructed, D. difficult to access. Correct answer, C. rationale. In healthcare, patent means open or unobstructed, allowing free passage. Question 6. The patient was moved to a quiet, serene room to help reduce anxiety. What does serene mean? A. noisy, B. overstimulating, C. calm, D. bright. Correct answer, C. rationale. Serene means calm, peaceful, or untroubled. Question 7. The nurse expects symptoms to recur if the patient stops taking their medication. What does recur mean? A. improve, B. happen again, C. worsen severely, D. disappear permanently. Correct answer, B. rationale. Recur means to occur again or return. Question 8. The provider noted a benign skin lesion. What does benign mean? A. cancerous, B. harmless, C. infected, D. invasive. Correct answer, B. rationale. Benign means mild, harmless, or non-cancerous. Question 9. A client with heart failure prefers to sleep upright due to orthopnea. What does orthopnea mean? A. trouble breathing when lying flat, B. excessive urination at night, C. sudden severe chest pain, dizziness when standing. Correct answer, A. rationale. Orthopnea is difficulty breathing when lying flat. Question 10. The nurse notes that the patient's emotions are labeled during the assessment. What does labile mean? A. stable, B. rapidly changing, C. absent, D. elevated. Correct. Answer, B. rationale. Labile means unstable or likely to change rapidly, especially mood or vital signs. Question 11. The nurse instructed the patient to abstain from caffeine before the procedure. What does abstain mean? A. increase intake, B. remove gradually, C. avoid voluntarily, D. measure carefully. Correct answer. C. Rationale. Abstain means to voluntarily avoid or refrain from something. Question 12. The child's cheeks were flushed after running a high fever. What does flushed mean? A pale. B. Bruised. C. Reddened. D. Inflamed. Correct answer. C. Rationale. Flushed refers to skin that appears red due to increased blood flow. Question 13. The provider noted that the patient's abdomen was distended. What does distended mean? A. Empty. B. Sunken. C. Swollen. D. Hardened. Correct answer. C. Rationale. Distended means enlarged or swollen due to internal pressure. Question 14. The nurse documented that the patient was apathetic during the interview. What does apathetic mean? A. Very talkative. B. Showing no interest. C. Extremely anxious. D. Confused. Correct answer. B. Rationale. Apathetic means showing little or no emotion, interest, or concern. Question 15. The provider explained the etiology of the patient's infection. What does etiology refer to? A. Treatment. B. Symptoms. C. Cause. D. Complications. Correct answer. C. Rationale. Etiology is the cause or origin of a disease. Question 16. The patient reported increased fatigue and decreased appetite, which are manifestations of anemia. What does manifestations mean? A. Causes. B. Risk factors. C. Visible signs. D. Medications. Correct answer. C. Rationale. Manifestations are observable signs or symptoms of a condition. Question 17. The nurse noted that the patient's wound remained intact. What does intact mean? A. Open. B. Unbroken. C. Infected. D. Painful. Correct answer. B. Rationale. Intact means unbroken or not damaged. Question 18. The provider instructed the nurse to initiate IV fluids immediately. What does initiate mean? A. Stop. B. Increase. C. Begin. D. Rotate. Correct answer. C. Rationale. Initiate means to begin or start something. Question 19. The patient was lethargic and slow to respond during assessment. What does lethargic mean? A. Hyperactive. B. Confused. C. Very sleepy. D. Irritated. Correct answer. C. Rationale. Lethargic means extremely drowsy or lacking energy. Question 20. The nurse recorded the patient's vital signs every 4 hours. What does vital mean in this context? A. Optional. B. Necessary for life. C. Mildly important. D. Painful. Correct answer. B. Rationale. Vital refers to something essential for sustaining life, such as heart rate or blood pressure. Question 21. The nurse noted that the patient's blood pressure became labile during the procedure. What does labile mean? A. Stable. B. Rapidly changing. C. Abnormally low. D. Completely normal. Correct answer. B. Rationale. Labile means unstable or likely to change rapidly. Question 22. The provider warned that continuing strenuous activity may exacerbate the patient's knee pain. What does exacerbate mean? A. Reduce. B. Measure. C. Worsen. D. Cure. Correct answer. C. Rationale. Exacerbate means to make a problem or symptom more severe. Question 23. The nurse used sterile water to flush the patient's IV line. What does flush mean in this context? A block. B. Rinse with fluid. C. Increase flow. D. Warm up. Correct answer. B. Rationale. Flush means to rinse or clean with fluid. Question 24. The patient was placed in isolation due to a contagious infection. What does isolation mean? A. Shared space. B. Separation from others. C. Complete rest. D. Protective clothing. Correct answer. B. Rationale. Isolation means keeping a person separate to prevent the spread of infection. Question 25. The nurse documented that the patient was irate when the medication was delayed. What does irate mean? A. Confused. B. Extremely angry. C. Sleepy. D. Calm. Correct answer. B. Rationale. Irate means very angry or enraged. Question 26. The patient showed symmetrical facial movements. What does symmetrical mean? A. Unequal on both sides. B. Painful when moving. C. Balanced and equal. D. Limited in range. Correct answer. C. Rationale. Symmetrical means equal or mirror image appearance on both sides. Question 27. The nurse educated the patient about the prognosis of their condition. What does prognosis refer to? A. Cause of disease. B. Expected outcome. C. Type of medication. D. Surgical procedure. Correct answer. B. Rationale. Prognosis means the predicted outcome or course of a disease. Question 28. The provider ordered a transdermal patch for pain control. What does transdermal mean? A. Taken by mouth. B. Injected under the skin. C. Delivered through the skin. D. Inhaled as vapor. Correct answer. C. Rationale. Transdermal means medication absorbed through the skin. Question 29. The child presented with a febrile temperature. What does febrile mean? A. Without fever. B. Very tired. C. Related to fever. D. Extremely hungry. Correct answer. C. Rationale. Febrile means having a fever. Question 30. The nurse instructed the patient to monitor their fluid intake closely. What does intake mean? A. Amount taken in. B. Amount eliminated. C. Amount breathed out. D. Amount injected. Correct answer. A. Rationale. Intake refers to the amount of fluid or substance taken into the body. Question 31. The nurse noted that the patient had a hematoma at the injection site. What does hematoma mean? A. Minor scratch. B. Localized collection of blood. C. Small rash. D. Fluid-filled blister. Correct answer. B. Rationale. A hematoma is a localized collection of clotted blood outside a blood vessel. Question 32. The provider explained that the medication may alleviate the patient's symptoms. What does alleviate mean? A. Diagnose. B. Worsen. C. Relieve. D. Conceal. Correct answer. C. Rationale. Alleviate means to make symptoms less severe or to relieve discomfort. Question 33. The nurse observed a concise report at shift change. What does concise mean? A. Very detailed. B. Incomplete. C. Brief and to the point. D. Difficult to understand. Correct answer. C. Rationale. Concise means expressing much in few words. Question 34. The provider determined the patient's wound was superficial. What does superficial mean? A. Deep and severe. B. On the surface. C. Highly infected. D. Rapidly spreading. Correct answer. B. Rationale. Superficial means existing or occurring at the surface, not deep. Question 35. The patient's dizziness was a complication of the new medication. What is a complication? A. A predictable outcome. B. An expected response. C. An unexpected problem. D. A guaranteed improvement. Correct answer. C. Rationale. A complication is an unexpected problem or secondary condition. Question 36. The nurse documented that the patient's airway remained patent after suctioning. What does patent mean? A. Completely blocked. B. Partially inflamed. C. Open. D. Swollen. Correct answer. C. Rationale. Patent means open and unobstructed. Question 37. The provider found the patient's skin to be intact with no signs of injury. What does intact mean? A. Broken. B. Infected. C. Uninjured. D. Dry and cracked. Correct answer. C. Rationale. Intact means whole, complete, and unbroken. Question 38. The nurse noted the patient's symptoms had gradually deteriorated overnight. What does deteriorated mean? A. Stayed the same. B. Improved slowly. C. Become worse. D. Become more stable. Correct answer. C. Rationale. Deteriorated means to decline or worsen. Question 39. The medication order required the nurse to dilute the solution before administration. What does dilute mean? A. Shake vigorously. B. Make weaker by adding liquid. C. Refrigerate. D. Make stronger. Correct answer. B. Rationale. Dilute means to make a liquid less concentrated. Question 40. The nurse monitored the patient's respiration closely after surgery. What does respiration refer to? A. Level of pain. B. Fluid balance. C. Breathing. D. Nutritional intake. Correct answer. C. Rationale. Respiration is the act of breathing in and out. Question 41. The nurse noted that the patient had an acute onset of abdominal pain. What does acute mean? A. Gradual. B. Mild. C. Sudden and severe. D. Unknown. Correct answer. C. Rationale. Acute refers to a sudden, sharp, or severe condition. Question 42. The provider confirmed the patient's tumor was malignant. What does malignant mean? A. Harmless. B. Cancerous. C. Small. D. Calcified. Correct answer. B. Rationale. Malignant means cancerous or harmful. Question 43. The nurse instructed the patient to void before surgery. What does void mean? A. Shower. B. Walk around. C. Urinate. D. Eat lightly. Correct answer. C. Rationale. In medical settings, void means to urinate. Question 44. The patient's endogenous insulin levels were insufficient. What does endogenous mean? A. Introduced from outside. B. Produced within the body. C. Artificially created. D. Stored long term. Correct answer. B. Rationale. Endogenous means originating from within the body. Question 45. The nurse identified a laceration on the patient's leg. What is a laceration? A bruise. B. Deep cut. C. Rash. D. Infection. Correct answer. B. Rationale. A laceration is a deep cut or tear in the skin. Question 46. The provider noted that symptoms were latent, showing no outward signs yet. What does latent mean? I. Obvious. B. Highly infectious. C. Hidden or not yet active. D. Extremely painful. Correct answer. C. Rationale. Latent means present but not visible or active. Question 47. The nurse reminded the patient to maintain good hygiene to prevent infection. What does hygiene refer to? A. Physical therapy. B. Cleanliness practices. C. Medication management. D. Dietary intake. Correct answer. B. Rationale. Hygiene involves practices that promote cleanliness and health. Question 48. The patient experienced orthopnea at night. What does orthopnea mean? A. Insomnia. B. Difficulty breathing while lying flat. C. Acid reflux. D. Rapid breathing during exercise. Correct answer. B. Rationale. Orthopnea is difficulty breathing when lying down. Question 49. The provider ordered a subcutaneous injection. Where is this injection given? A. Into the muscle. B. Under the skin. C. Into the vein. D. Into the joint space. Correct answer. B. Rationale. Subcutaneous means beneath the skin. Question 50. The nurse used context clues to infer the meaning of the patient's statement. What does infer mean? A. Suggest indirectly. B. Conclude from evidence. C. Confirm with testing. D. State clearly. Correct answer. B. Rationale. Infer means to deduce or conclude based on evidence. Question 51. The provider explained that the medication was highly efficacious in treating the infection. What does efficacious mean? A. Ineffective. B. Very effective. C. Harmful. D. Experimental. Correct answer. B. Rationale. Efficacious means capable of producing the desired effect. Effective. Question 52. The nurse reminded the patient not to ingest food before the procedure. What does ingest mean? A touch. B. Smell. C. Swallow. D. Avoid. Correct answer. C. Rationale. Ingest means to take something into the body by swallowing. Question 53. The patient's blood pressure decreased after the medication depressed the heart rate. What does depressed mean in this context? A. Lowered. B. Strengthened. C. Stabilized. D. Ignored. Correct answer. A. Rationale. In medical use, depressed means lowered or reduced. Question 54. The nurse noted that the chemical was not permeable to water. What does permeable mean? A. Unable to pass through. B. Absorbs sound. C. Allows passage through. D. Easily broken. Correct answer. C. Rationale. Permeable means allowing substances to pass through. Question 55. The doctor noted that the patient's symptoms were ongoing. What does ongoing mean? A. Recently resolved. B. Constant and continuing. C. Very mild. D. Only at night. Correct answer. B. Rationale. Ongoing means continuing or still in progress. Question 56. The nurse observed a palpable mass in the patient's abdomen. What does palpable mean? A. Invisible. B. Felt by touch. C. Highly painful. D. Difficult to diagnose. Correct answer. B. Rationale. Palpable means capable of being felt or touched. Question 57. The provider instructed the team to follow the surgical protocol carefully. What does protocol mean? A. Patient request. B. Medication error. C. Official procedure. D. Personal preference. C. Rationale. Protocol refers to an official set of procedures or rules. Question 58. The nurse noted that the infection spread in a rampant manner. What does rampant mean? A. Slowly and predictably. B. Growing out of control. C. Completely healed. D. Only affecting one area. Correct answer, B. Rationale. Rampant means widespread and rapidly increasing. Question 59. The patient's diet was replete with essential nutrients after the intervention. What does replete mean? A. Lacking. B. Full. C. Rotten. D. Contaminated. Correct answer, B. Rationale. Replete means supplied in abundance. Full. Question 60. The physician asked for a retrospective review of the patient's past lab results. What does retrospective mean? A. Predicting the future. B. Concerning current events. C. Looking back on past events. D. Focused on minor details. Correct answer, C. Rationale. Retrospective means reviewing or relating to past events. Question 61. The nurse explained that the medication is antipyretic. What does antipyretic mean? A. Reduces fever. B. Causes sleep. C. Prevents nausea. D. Increases appetite. Correct answer, A. Rationale. An antipyretic is a drug that lowers fever. Question 62. The patient appeared docile and followed instructions easily. What does docile mean? A. Resistant. B. Easily managed. C. Confused. D. Emotionally unstable. Correct answer, B. Rationale. Docile means calm, cooperative, or easy to manage. Question 63. The patient experienced emaciation due to prolonged illness. What does emaciation refer to? A. Bruising. B. Severe weight loss. C. Rapid heartbeat. D. Excessive sweating. Correct answer, B. Rationale. Emaciation means extreme thinness or wasting of the body. Question 64. The child required an exam of their optic nerve. What does optic relate to? A. Muscle movement. B. Hearing. C. Vision. D. Digestion. Correct answer, C. Rationale. Optic refers to the eye or vision. Question 65. The patient was diagnosed with a pathogenic infection. What does pathogenic mean? A. Easy to cure. B. Causing disease. C. Mildly irritating. D. Highly visible. Correct answer, B. Rationale. Pathogenic means capable of causing disease. Question 66. The nurse prepared a prophylactic treatment before the procedure. What does prophylactic mean? A. Diagnostic. B. Emergency. C. Preventive. D. Experimental. Correct answer, C. Rationale. Prophylactic refers to something done to prevent disease. Question 67. The wound was identified as a lesion on the patient's arm. What is a lesion? A. Normal skin fold. B. Any abnormal tissue damage. C. A fungal infection. D. A healed scar. Correct answer, B. Rationale. A lesion is any abnormal break or change in tissue. Question 68. The nurse observed that the medication had a potent effect. What does potent mean? A. Very strong. B. Slow acting. C. Mildly effective. D. Difficult to swallow. Correct answer, A. Rationale. Potent means powerful or having a strong effect. Question 69. The provider noted neurologic deficits during the examination. What does neurologic refer to? A. Kidney function. B. Digestive health. C. Nervous system. D. Bone structure. Correct answer. C. Rationale. Neurologic pertains to the brain, spinal cord, and nerves. Question 70. The patient showed signs of virulent infection. What does virulent mean? A. Difficult to detect. B. Highly infectious or harmful. C. Slow to develop. D. Mild and self-limiting. Correct answer. B. Rationale. Virulent describes something extremely harmful or infectious. Question 71. The nurse noted a hematologic disorder in the patient's lab results. What does hematologic refer to? A. Skin tissue. B. Blood and blood-forming tissues. C. Digestive organs. D. Hormone levels. Correct answer. B. Rationale. Hematologic relates to blood and blood-forming structures. Question 72. The patient showed signs of hypotension after standing up quickly. What does hypotension mean? A. High blood pressure. B. Irregular heart rate. C. Low blood pressure. D. Fluid overload. Correct answer. C. Rationale. Hypotension is low blood pressure. Question 73. The provider identified the rash as benign and not a serious concern. What does benign mean? A. Cancerous. B. Harmless. C. Spreading. D. Infectious. Correct answer. B. Rationale. Benign means mild or not harmful. Question 74. The wound exhibited rapid proliferation of tissue during healing. What does proliferation mean? A. Breakdown. B. Rapid increase or growth. C. Scarring. D. Bleeding. Correct answer. B. Rationale. Proliferation means rapid growth or reproduction. Question 75. The patient's symptoms were subtle and easy to overlook. What does subtle mean? A. Obvious. B. Slight or faint. C. Extremely painful. D. Unusual. Correct answer. B. Rationale. Subtle means not obvious or barely noticeable. Question 76. The nurse documented that the patient's response was objective. What does objective mean? A. Based on personal feelings. B. Influenced by fear. C. Based on observable facts. D. Related to pain level. Correct answer. C. Rationale. Objective means factual and not influenced by emotions. Question 77. The patient's skin appeared flaccid due to muscle weakness. What does flaccid mean? A. Firm. B. Tight. C. Limp. D. Painful. Correct answer. C. Rationale. Flaccid means limp or lacking firmness. Question 78. The nurse observed superficial abrasions on the forearm. What does superficial mean? A deep B on the surface. C. Actively bleeding. D. Infectious. Correct answer. B. Rationale. Superficial means at the surface of the skin. Question 79. The provider said the cause of the disease was idiopathic. What does idiopathic mean? A. Inherited. B. Caused by infection. C. Without a known cause. D. Easily diagnosed. Correct answer. C. Rationale. Idiopathic means arising from an unknown cause. Question 80. The physical therapist measured the patient's knee flexion. What does flexion refer to? A. Straightening a joint. B. Bending a joint. C. Swelling of tissue. D. Rotating a limb. Correct answer. B. Rationale. Flexion means bending a joint or decreasing the angle of the joint. Question 81. The nurse educated the patient on proper elimination habits after surgery. What does elimination refer to? A. Digesting food. B. Removing waste from the body. C. Absorbing nutrients. D. Increasing appetite. Correct answer. B. Rationale. Elimination refers to removing bodily waste, such as urine or stool. Question 82. The provider noted a cursory examination during triage. What does cursory mean? A. Very thorough. B. Painful. C. Quick and not detailed. D. Difficult to perform. Correct answer. C. Rationale. Cursory means done quickly with little attention to detail. Question 83. The patient's skin was warm and flushed after exercising. What does flushed mean? A. Pale. B. Swollen. C. Red in appearance. D. Dry. Correct answer. C. Rationale. Flushed means reddened skin, often from heat or exertion. Question 84. The provider described the swelling as diffuse across the abdomen. What does diffuse mean? A. Localized. B. Spread out. C. Pulsating. D. Intermittent. Correct answer. B. Rationale. Diffuse means spread widely or not concentrated in one spot. Question 85. The nurse observed that the medication might mitigate the patient's discomfort. What does mitigate mean? A. Eliminate entirely. B. Increase quickly. C. Make less severe. D. Hide from view. Correct answer. C. Rationale. Mitigate means to lessen the severity of something. Question 86. The patient was placed in the prone position for the procedure. What does prone mean? A. Lying face down. B. Lying on the side. C. Sitting upright. D. Unable to move. Correct answer. A. Rationale. Prone means lying face down. Question 87. The nurse instructed the patient to report any adverse reactions to the medication. What does adverse mean? A. Pleasant. B. Harmless. C. Harmful or unfavorable. D. Temporary. Correct answer. C. Rationale. Adverse means harmful or negative. Question 88. The provider noted that the patient's skin remained intact after the fall. What does intact mean? A. Bruised. B. Unbroken. C. Missing patches. D. Extremely dry. Correct answer. B. Rationale. Intact means not broken or damaged. Question 89. The nurse instructed the patient to monitor their status throughout recovery. What does status mean? A. Weight. B. Current condition. C. Past history. D. Expected outcome. Correct answer. B. Rationale. Status refers to a person's current condition or state. Question 90. The provider explained that the bacteria were not ubiquitous in this environment. What does ubiquitous mean? A. Rare. B. Found everywhere. C. Difficult to detect. D. Highly dangerous. Correct answer. B. Rationale. Ubiquitous means present everywhere or widespread. Question 91. The nurse informed the patient that the medication was analgesic. What does analgesic mean? A. Prevents infection. B. Relieves pain. C. Increases appetite. D. Causes drowsiness. Correct answer. B. Rationale. An analgesic is a medication that reduces or relieves pain. Question 92. The patient's symptoms were described as chronic in nature. What does chronic mean? A. Short-term. B. Recurring or long-lasting. C. Extremely severe. D. Unpredictable. Correct answer B. Rationale. Chronic refers to a condition lasting a long time or recurring frequently. Question 93. The nurse noted that the patient was ambivalent about starting treatment. What does ambivalent mean? A. Very excited. B. Showing mixed feelings. C. Angry. D. Uninterested. Correct answer B. Rationale. Ambivalent means having mixed or conflicting feelings. Question 94. The patient's arm became edematous after the injury. What does edematous mean? A pale. B. Swollen with fluid. C. Bruised. D. Cold to the touch. Correct answer B. Rationale. Edematous refers to swelling caused by fluid buildup. Edema. Question 95. The provider explained that the symptoms were precipitous in onset. What does precipitous mean? A. Very slow. B. Very fast or sudden. C. Mild. D. Intermittent. Correct answer B. Rationale. Precipitous means rapid or sudden. Question 96. The nurse noted that the patient's mood was unusually stoic during the painful procedure. What does stoic mean? A. Overly emotional. B. Showing no emotional response. C. Confused. D. Unaware of surroundings. Correct answer B. Rationale. Stoic means showing little or no reaction to pain or emotion. Question 97. The therapist encouraged the patient to ambulate twice daily. What does ambulate mean? A. Sit upright. B. Walk. C. Sleep. D. Stretch. Correct answer B. Rationale. Ambulate means to walk or move about. Question 98. The nurse explained that the treatment was therapeutic. What does therapeutic mean? A. Harmful. B. Intended to heal. C. Unnecessary. D. Experimental. Correct answer B. Rationale. Therapeutic means having healing or beneficial effects. Question 99. The patient's skin color was cyanotic after the respiratory event. What does cyanotic mean? A. Yellow. B. Blue or bluish tint. C. Pale white. D. Red and flushed. Correct answer B. Rationale. Cyanotic refers to a bluish discoloration due to low oxygen levels. Question 100. The nurse recognized a contraindication for the medication. What is a contraindication? A reason to increase treatment. B. A reason to avoid a treatment. C. A sign of successful therapy. D. A minor side effect. Correct answer B. Rationale. A contraindication is a condition or factor that makes a treatment unsafe or inadvisable.